Well, my name is Gunnar Karlsson. I'm a chairman of the FH Sweden organization. It's a patient organization focused on people with FH, inherit high cholesterol. We were established around 2010, and the reason for starting this organization was mainly that we realized that most of the patients with FH were not diagnosed or treated. I think in Sweden we have just 3% of estimated number of FH patients were identified. So we started, and the first thing we did was try to figure out where do we stand when it comes to guidelines and how is the healthcare developed to support the FH healthcare system. So we developed a strategy together with at least 20 professionals in the FH area. So we wrote a strategy to explain FH and also how to best organize the healthcare in Sweden to be able to identify all the patients and to get them proper treatment. And we created a vision, and that says that before end of 2025, we should have identified 80% of estimated number of FH patients, which means that around 30,000 should be identified before 2025. That document and our vision was presented to the National Board of Health and Welfare because they were rewriting the guidelines. And at that time, when they saw what we had done and the solution we provided, they included FH in the new guidelines that was presented end of 2015. And I think that was a key step, key achievement, not just for the FH, but also for the healthcare professionals. So what we have then moved, the next step is that we have now started to follow up what's happening, how is the new guidelines implemented, and how can we support the implementation. And to do that, we, on a regular basis, once per year, send out a questionnaire to 21 different regions and ask them what the status of the implementation and how many FH patients have you identified. And we have seen in 1 year they have increased with 5 to 10%, which is very impressive in a sense. And to follow up with that, we also have then focused now to educate the general public. So we run information events where we offer free testing of cholesterol, and we also present and talk about FH and lifestyle and eating habits or lifestyle in the whole. So that's also to support, to put pressure from the public, general public, on the politicians. You need to solve it. We also have together with each region, we are also introduce this FH to primary care, because the concept includes both primary care and FH centers, and how the communication, how patients are sent to centers and everything. So the whole healthcare structure has been educated and moved out. So that's what we are doing for the moment. We are also involved in when it comes new medication. We have a special authorities that defines if this is going to be reimbursed. We do have regular meeting with them to give our input and influence them. So we have all the decision-making bodies, we try to involve ourselves, and we are now regularly invited to give our input